Hi, everyone. It's a quick note to say what you're about to watch is an unscripted coaching conversation I've had with Dr. Ramaniga, who has actually passed the AMC clinical examination. This is not a structured way, this is an informal teaching session, but I hope this will teach you what to do in a real AMC clinical OSCE exam. So what do we look at today? So what case you want to do?
I was wondering if we could do a side case today. I think an MSc presentation.
Okay, which one?
Yeah.
Okay, I can do I'll tell you the case. Let's do, the guy is coming for his lithium review.
Okay.
What do you say? 8 minutes?
All right. Yeah.
Let me put the time in. Ready when you're?
Okay. Yeah.
Okay, start.
Hi, my name is Dr. Shashi. I'm the doctor taking care of you today. How can I help you?
I'm here for my medicine review, doctor. I would like to have the script reviewed.
All right. Can I just confirm your name and age, please?
My name is Karen and I am 38 years old.
All right. Hi, Karen. It's lovely to meet you. Okay. So medicine review for lithium, you said? Right. So can I ask you a couple more questions so I just get a rough idea on how you've been doing?
Sure.
Perfect. So since when have you been on lithium? How long?
It's now 2 years.
All right. And do you know why you were put on lithium?
I was told that I have borderline personality disorder.
All right. And how are you doing? How's your mood been?
Okay.
Okay. And have you been sleeping well?
Yeah. Okay.
Okay. How many hours do you sleep?
About 6-7 hours.
All right. And how's your appetite been?
Good.
Okay. And just wanted to ask you some sensitive questions. I know it might seem out, but then it's a regular question that I ask all my patients. So have you ever considered a thought of harming yourself or others?
No.
All right. And do you see, hear, feel things that other people don't?
No.
All right. And do you have ideas or certain opinions that other people find weird?
No.
All right. Do you feel like other people are always judging you, thinking of hurting you?
No.
All right. And do you live alone or who do you live with?
I live with my parents.
Okay. How are they? Are they supportive?
Yeah. Yeah.
All right. And do you think the lithium is working for you so far?
Sorry, what is that?
Do you think the lithium is working for you so far? Like, do you have any shakes, any tremors?
No, I don't.
All right. And do you have any changes in your bladder and bowel?
Like what?
Do you have, are you passing normal quantity of urine, less quantity, stuff like that?
No, not really.
Okay. Do you remember when you took the last blood test for your lithium, like a serum calcium?
It was 2 months ago.
All right. And was it normal? Was there anything abnormal about it?
No, it was normal.
Okay. Oh, thank you so much. Also, do you think, like when you started off, do you think that you needed help because it was getting the Okay. All right. Right now, do you know where you are?
Yes, I'm in the clinic.
Perfect. Do you know who I am?
You're my doctor.
Okay. Cool. And do you know what time of day it is?
Yeah, it is May 24th and evening.
Okay, cool. Perfect. And now this is a hypothetical question. If there was a fire in this room, what would you do?
Definitely.
I'm sorry?
I will run, definitely.
Okay, perfectly fine. Yeah, that's cool. All right, that's nice. And just wanted to ask you, are you compliant with your medication? Do you take it as prescribed?
Yes.
Okay. Do you drink alcohol? Do you take any other medications on top of it?
No.
Okay. Do you take any painkillers, your over the counters?
No.
All right. Any use of recreational drugs, stuff like that?
No.
All right, perfectly fine. Thank you so much, Karen, for helping me out. I'll just present the mental state examination. This is a mental state examination of a 38-year-old Karen who's coming for a lithium review. She was diagnosed by borderline personality disorder 2 years ago. On appearance, she is well groomed. She's beautiful. She's not maintaining eye contact. She seems very agitated, and she is I established rapport, but she's looking here and there. Speech, I looked at rate, volume, and tone. The rate is low, slow. Volume is also low. Um, in between the interview, she has monosyllabic responses, and sometimes she's actually elaborating on herself.
Mhm.
Emotion, I asked how she's doing. She said she's doing okay. And the affect is congruent with that because she
Mhm.
seems doing okay.
Mhm.
Perception, I asked for hallucinations. There are no current visual or auditory hallucinations. Thought, form, and content. Form is linear. Content, there's no suicidal ideation, and she's to the point. So, yeah. Insight, she knows that she needs help. So, insight is there. Cognition, she's oriented time, place, and person. And judgment is as well, is intact. Risk, she's compliant with her medication. She follows it up. She takes her test was 2 months back and she knows it's normal. She's not having an active hallucination or delusion. And no risk of suicide as well. Rapport is maintained. She's actually talking to me, even though she seems, a bit hesitant and dull. Yeah, and I want to take another, collateral history with another person she lives with. That's it. Thank you.
You made the classic mistake.
I know. What did I do?
What is the task?
Was it not MSc?
I said the lithium review, right?
Oh, okay.
Unscripted.
So I have to. Oh no. Oh, I have to
That's okay.
do it.
This is brilliant. So, as many of you will notice, for the other students who will be watching this, this is not scripted. None of this is. Ramini is just sitting there. She's just about to go for her work, and I caught her now and asked her, "Can we do a couple of videos?" And this is how it went. And this is a teaching moment because if you don't read the question carefully, you will think however well you did the case. In the beginning, I asked her for the lithium review. She did it beautifully. She actually looked for the side effects of the lithium, asked if the patient is taking any over-the-counter medications, etc. But what did you not flag, Ramaniga?
I think I mean, I had to talk
So
about the
eye
review
contact
script,
was missing,
travel
right?
out.
No, no, eye
Sorry?
contact was missing, right?
Yeah, eye
So that
contact was
means
missing.
patient still has depression, probably.
Yeah.
So we need to
She,
flag that.
okay. Yeah. She said she was doing okay, but then it didn't sound like she was doing okay.
I actually had a case like this for my
Okay.
exam. So the patient sat, and every question that I asked, it was like, "How is your mood?" He said, "All right." "How's your appetite?" He said, "All right." And the whole question went. So none of the CG caps came true for the case.
Yeah.
Obviously, if there's no eye contact. So I remember I ended it like this. I'm concerned for the patient because it was male patient, men between the age of 35 and over, actually 40 and over, is at increased risk of suicide. And the patient has not been having any eye contact with me, and I'm concerned for the patient.
Um,
And the lithium was, at that time, I think the patient's lithium was within the normal limit. That's what I remember. But that is
okay.
how the case went. But it was okay. It's good. That see how easy it is to make a
I
book.
know. I completely forgot the task. I said MSc and I said, okay, MSc.
I know that years ago when I was a little girl, and for history examination, we have this questions, multiple choice questions that come.
Yeah.
And for whatever reason, before I went into the class, someone asked me who was a UN Secretary General, and I didn't know. So I asked somebody else, and they said the word, whatever the name was. I can't remember it was them. I think it was, I can't remember what the name was. Anyway, I remembered that name and I kept reciting in my head. So I went in, without reading the question, I saw that option was one of the answers and I picked it. So I'm the only one who got it wrong, by the way. The question was, who is the Prime Minister of Malaysia? And I wrote who is a UN Secretary General as the answer. How do you get a question wrong? But I'm capable of doing that. Again, I think that was my first lesson in life that I actually have to read the question before I find what the answer is.
Yeah. No,
Okay.
no, makes sense.
Okay. What is the next one we want to do?
Um, your choice. Anything?
Okay. Still psychiatry?
Yeah.
Okay. So we'll do it today. Actually, we can do suicide risk assessment.
Oh, okay. Yeah.
I'll turn off, put the new timer on.
Mm.
Ready? Okay.
Yeah.
Yeah. It's okay. If you get it wrong, you passed the exam. So no
I
drama.
know. Why does it feel so bad that every time I do this with you, I'm just like, oh my God, am I in Melbourne? Oh my God, I'm in India. I'm so many miles away.
It is the
Why am
part.
I getting drinks? It feels like
Recently, I had another doctor that I trained. Last Sunday, he gave the class for the how to manage stress. And one of the things he actually said was that that's me, tortured him throughout the class. Okay. The thing is, I could see the other people who were my students going through it. I'm sure they all laughed at the same time because me being pedantic, I know I torture people,
I
but
know because I hear Dr. Buddhi and Dr. Ajni tell me like, oh my God, I have palpitations, and I said, oh no, join the club, like join the club. Are you telling me like are you asking me advice to not get palpitations? So sorry, like oh, she's
don't
like
stress.
I
You passed.
yeah no yeah thank you. Cool.
All
Yeah, I
right,
don't
let's
think
go.
this again and again ever in my life, but yeah, cool.
Let's go.
All right. Hi, my name is Dr. Shashi. I'm the doctor here taking care of you today. Can I confirm your name and age, please?
My name is John, and I am 40 years old.
Hi, John. It's really nice to meet you. How can I help you, John, today?
Oh, I was here because the doctors wanted me to talk to you before I go home when I
Oh,
discharge from
perfectly
the
fine.
hospital.
Oh, yeah. How are you feeling at the moment, though?
All right.
All right. I know life gets ahead of you. It's so difficult. God damn it. But it's all right. I'm glad that you're here. Okay. So I'm just going to ask you a couple of questions and some may be a little personal, but I assure you it's going to stay between you and me as long as there's no risk to you and others. Yeah.
Mhm.
Perfectly fine. So can you tell me, can you describe how you're doing with your mood?
Mood is good.
Okay, good. And what do you do for work?
I'm an accountant.
All right. And is it a stressful job?
Pretty.
Okay. Are you getting enough sleep?
No, not enough. It's very hard to sleep most of the time.
Is it very hard to go to sleep, or do you wake up in the middle of the night and then it's difficult to get to sleep?
I find it very difficult to go to bed.
Ah, okay, that's hard. How long do you stay in the bed and then fall asleep?
Okay. So I have sheeps. I paint them in different colors, the rainbow colors. I coral them into my rainbow pens, and then I count them, and I still am awake. So
Oh
11.
no, that sounds tough, John. Okay. Do you get any nightmares or anything like that? Okay. How is your appetite been?
Bit low.
Have you lost any weight though?
No.
All right. Okay, this is going to be jarring, but do you do you feel like you want to harm yourself or harm others? You ever get the feeling that, you want to do that?
Sometimes yes.
All right, sometimes. And have you ever acted on it?
No.
No. Do you have a plan to act on it though?
I do think about it sometimes.
All right. When you think about it, do you have a plan on how you want to do it? Have you formulated that?
Oh, I have many options. Jumping in front of the train, maybe, I don't know, hang myself. I thought of it.
Okay. All right. And do you see, hear, or feel things that other people don't?
No.
Okay. And do you have other ideas and opinions that other people might find weird?
No.
All right. And who do you live with?
With my wife.
With your wife? Yeah. And how is it going? Is she supportive? How is your
Yeah.
marriage going?
She's very supportive.
Oh, perfect. That's nice. And do you drink alcohol or do you do any recreational drugs?
No,
No. All right. Is there a past history of any mental health issues or any medicines that you've taken for your mental health?
no,
Okay. Is there a family history for any mental health issues? Your mom, your dad?
no.
Okay. Um, do you think that given the required support, I mean, do you think that you would require help if given support and a support system?
I'm okay. I have help.
What help do you have? Are you currently using any help? What is the support system that you use?
I have a lot of family support. My wife is very,
Mhm.
very supportive. And I also have the community. I go to church, so I have the church supporting me.
Oh, that's perfect. Yeah, I get it. Are you particularly religious?
Yes, I am very religious.
Oh, that's very nice. Okay. And is there a point in life that you felt insanely happy, like, oh, like top of the world?
Mm,
No. Okay. Um,
that's good. That's good. I know you start. You passed the exam. Don't stress. All right. So what worked here is that you looked pretty good with a lot of things, but when the patient said that he has considered doing it, you always
yeah.
want to know the protective factors.
Yeah, like I mean, I wanted to know about alcohol. I wanted to know about like support system, like if he's
Yes.
living alone.
Mhm.
I mean, he's already in a risk because he's male and he's 40,
Got it.
so that's there.
Yeah.
And he's depressed. He's not feeling that great. He's already thought about it, which is
Yes.
bad. He already
Yes.
thought multiple ways of doing it.
Hmm? Okay. So we
Uh,
know that we need to identify the four P's, the formulations here. What
yeah.
precipitates, what predisposes, what protects, and there should be one more P. I can't remember. I never get all four P's in a row. Every time one is missing. I don't know why. So protective, precipitating, predisposing. There should be one.
And something else. Yeah.
No, no, one more P.
Protective, precipitating, predisposing, and yeah, no, I'll just check it out.
How do I miss it? It's like the five P's. I also miss the five P's for female, one of them, and this one is another one. Okay, let's see. Precipitating, predisposing, protective, perpetuating.
Yeah. Continuing.
Perpetuating.
Yeah.
So you kind of need to look at those factors too. And so in a suicide risk assessment, we don't really need to do a lot of mental state examination.
Yeah.
So we use the sad person's mnemonics. Remember at some stage
Yeah.
I taught you that? So we follow
Yeah.
that. You did it right. That's it. That's good. You did well. All right.
My query is like, he has protective factors. He's already at risk. So, perpetuating factors are factors that continue to put him at risk, right?
Yeah, his
So,
work.
his
And not
work,
sleep.
his stress, and yeah, no sleep. Okay, perfect. Okay.
And
Yeah.
so we need to make sure that he is taken care of. So you need to flag it, say that he is at risk. He has thought of it. And, now we need to make sure he doesn't kill himself. So encourage him to go to either Lifeline or have more talk therapy with the CBT, etc.
Okay. Cool.
That's it. But you did well.